Spider veins and varicose veins are a very common problem. We see them in men and women, and we see them in people of all different ethnic backgrounds. More commonly, we do see them in women, particularly women who have had either single pregnancy or multiple pregnancies. In addition, family history plays a really big part in whether you develop spider veins or varicose veins. If your mother or father have had, if your mother or father have a history of varicose veins or spider veins, you will be more likely to have them as well. Spider veins and varicose veins can cause symptoms such as pain in the legs, swelling of the legs, uh, leg fatigue or heaviness. They can cause itching and burning right over the areas of the spider veins or the varicose veins. Those are the most common symptoms. More severe symptoms such as extreme swelling or darkening of the skin color or even skin ulceration are possible, but much less likely. With modern treatments, you no longer need traditional surgical techniques or surgical treatments for treatment of your varicose veins or spider veins. We can now treat all varicose vein and spider vein problems with outpatient, office-based procedures that are very successful, far fewer complications, much safer with much higher success rate and easier recovery as compared to traditional surgical techniques. Spider veins and varicose veins are most commonly seen in the legs. We often do have patients come in with spider veins on the face that they would like to have removed as well, and we can treat those with different types of techniques. The likelihood of varicose veins coming back after adequate treatment is very, very low. Unfortunately, with spider vein treatments, that's not the case. Even after adequate treatment for spider veins do have a tendency to come back in the future, hopefully several years down the road. But it's just a function of patients being predisposed to developing new spider veins in the future. I'm a board-certified interventional radiologist, which means I've been formally trained uh, in the treatment of venous and arterial diseases using minimally invasive procedures and imaging guidance, which means using ultrasound, CAT scan, and x-rays to guide our procedures. So I've gone through the formal training process of treating venous problems like varicose veins, spider veins, and other multiple venous abnormalities using these minimally invasive techniques and accomplishing the entire procedure through tiny little incisions or nicks in the skin. The advantages of having your care performed at Miller Vein as opposed to a hospital-based setting or even another outpatient office-based setting is that we specialize only in the treatment of venous disease. In other words, we focus all our attention on all our procedures and all our diagnosis on diseases of the veins, specifically varicose veins and spider veins. So our entire staff is well versed in all the different procedures that specifically are related to treatment of varicose veins and spider veins, and that's what you get when you come to our facility. Other places, they perform a multitude of different non-related procedures. Here, every one of our staff is well versed and very comfortable in dealing with your specific needs and your vein abnormalities. By and large, insurance will pay for treatment of spider veins and varicose veins in the majority of insurance carriers. Unfortunately, for spider vein treatments, it's still, for the most part, an out-of-pocket expense, and most carriers will not cover the expense for treatment of spider veins. At Miller Vein, we offer a wide variety of treatments for spider veins and varicose veins, and we tailor the use of those treatments to every individual patient. In other words, we have a variety of different tools and techniques to treat different veins, but every patient is different and individual, and so we personalize the treatment plans for each individual patient to satisfy their needs and their goals. We perform procedures using laser and radiofrequency devices. We also perform sclerotherapy for spider veins, as well as using a newer device called VeinWave for treatment of spider veins as well. One of the newest treatments available in the market for varicose veins is Clarivein, and we are one of the first people in Michigan to be using this device as well. The process begins by coming to our office. We perform a comprehensive examination on your first visit, and the most important thing is really listening to our patients to really get an idea as to what their goals and objectives are, what kind of problems they're having, what kind of symptoms they have, and then at that point, most patients will need an ultrasound examination to figure out what abnormalities are underneath the skin that we can't see on the surface of the skin with our eyes. So the combination of a detailed physical examination, ultrasound examination, and just listening to the patient will help us to decide in conjunction with the patient what's the best treatment plan. In general, the recovery time is little to none. Our patients, after any and all our procedures, our patients are able to be up and around and moving and doing most of their normal activities either the same day or the next day after the procedure. There's very little downtime with regards to work as well. Most patients feel well enough to resume work either the same day or the day after the procedure. Miller Vein has 3 locations. We have our Troy office, we have our office in Novi, and we have our newest office in Dearborn. The subspecialty of interventional radiology deals with the treatment of venous and arterial disorders and other disorders of the body using minimally invasive techniques and using imaging guidance such as ultrasound, CAT scan, and x-rays to help guide the procedures. We've been innovators in the treatment of venous disease since the beginning of our subspecialty back in the 1960s. We have been with regards to varicose veins specifically, we've been the major innovators in the most modern treatments of varicose veins developed as recently as 10 years ago. A phlebologist is a medical subspecialist who deals specifically in the treatment and the diagnosis of venous disorders. You should expect to see results immediately following treatment for your varicose veins. The first thing you will notice is that if you had any symptoms associated with your varicose veins prior to your procedure, you'll notice that there will be an immediate either complete resolution or significant improvement in your symptoms following your procedure. In addition, your varicose veins will look significantly, if not completely better, immediately following the procedure. With spider vein treatments, it does take several treatment sessions to obtain the optimum visual results that our patients desire.